Hello, licensemedical.com. We review today one important question in gastroenterology stating 52 years old businessman presented with intermittent lower abdominal pain along with diarrhea and passage of fresh blood per rectum. Colonoscopy found to have 4 small adenoma. Patient was concerned about his problem and asked advice about the screening protocol for this condition if needed in the future. How this patient should be screened. 5 yearly surveillance with colonoscopy, 3 yearly surveillance with colonoscopy until 2 consecutive examination negative, repeat endoscopy at 1 year, then every 3 years, no surveillance is required, repeat colonoscopy after 6 months and then after 1 year. Before answering this question, you should have in mind the guidelines for colon polyp surveillance organized by the British Society of Gastroenterology. Here in this table we'll review together the British Society of Gastroenterology guidelines. They divide the groups of colon adenoma under 3 risk groups. The low risk patients who has 1 or 2 only adenoma and both of them are small, less than 1 centimeter. So it's only if you do colonoscopy for 1 and you found only 1 or 2 adenoma, small in size, 6 millimeter, it is low risk patient and he has to do colonoscopy in 5 years time as a surveillance colonoscopy. But if we find high risk patient, for example, have 5 small adenoma or more, so this patient has tendency to have more polyps, more adenoma, or if we find 3 or more and one of them is larger than 1 centimeter, this is divided into high risk groups. This patient is high risk to develop more adenoma and is in the future can develop cancer. So this patient should have surveillance in 1 year time. In between these 2 groups of the low risk with 1 or 2 and both are small, or large number 5 or more, or larger size 1 of 3 in number and 1 are large more than 1, we have the intermediate risk group. If we find 3 or 4 small adenoma, here 1, 2, 3, 4, here 5. So if we find 3 to more small adenoma, it is intermediate risk and should do surveillance in 3 years time. If we this 3 or 4 adenoma, but if we find 1 of these adenoma more than 1 centimeter, so it is also intermediate. But if we find 3 and 1 more than 1 centimeter, it goes to the high risk group. Again, high risk is 5 or more small, or 3, 1 of them larger than 1 centimeter, or in the other side very small and 1 or 2 only, so it is low risk. But if we find 1 or 2 and size more than 1 centimeter, it goes to intermediate risk. And if we find 3 or more and size more than 1 centimeter, it goes to high risk. Return again to this question. This patient has 4 small adenoma, which is here intermediate, and the 3 years surveillance will be appropriate answer. Sometimes question come with this scenario saying he has 3 polyps, 2 by histopathology, 2 adenoma and 1 hyperplastic, 2 small polyps, 5 or 6 or 8, and one of them hyperplastic, which is not counted with the adenoma. So actually has 2, and the small which is 5 years. Okay, and good luck in your examination.